Have you ever wondered why some children seem to struggle with understanding words or expressing their thoughts, even when they hear just fine and seem otherwise bright? It is a common question for many parents, and understanding the answer can truly make a difference. A language disorder in children is a type of communication disorder where a child has persistent difficulties in acquiring and using language due to deficits in comprehension or production. It means they might struggle with either understanding what others say, expressing their own ideas, or both. This is not about being quiet or having a different accent. It is a genuine challenge with the language system itself. The core reason behind a language disorder is often a difference in how the brain processes language. This is not due to a lack of intelligence or effort, but rather a neurodevelopmental variation. Think of language development as building a house. There are many components: vocabulary, grammar, sentence structure, and the ability to tell stories. For a child with a language disorder, some of these building blocks might be missing or not connecting properly, making it harder to construct and understand linguistic structures. These difficulties can stem from genetic factors, or sometimes, the cause is simply unknown. It is a distinct challenge from a speech disorder, which affects the physical production of sounds, or hearing impairment, which affects sound reception. So, how might you notice if a child is experiencing a language disorder? Observe if they struggle to follow multi-step directions, have difficulty putting words together into sentences, or use very limited vocabulary for their age. They might also frequently restart sentences, substitute words, or have trouble retelling a story in a logical sequence. It is important to compare these observations to typical developmental milestones for their age. One insider detail to understand is the difference between receptive and expressive language. Receptive language refers to a child's ability to understand spoken or written language. Expressive language is their ability to use words, sentences, and gestures to communicate their thoughts. A child can have difficulties in one or both of these areas, and recognizing which one is affected helps guide support. Another important term is specific language impairment, often referred to as SLI, which describes a language disorder that is not associated with other developmental delays or conditions. Recognizing these signs early and understanding the underlying mechanisms of language disorders empowers parents and caregivers. Seeking a professional evaluation from a speech-language pathologist can open the door to tailored interventions. This proactive approach can significantly help a child develop stronger communication skills, foster their confidence, and ensure they have every opportunity to thrive in learning and social interactions.